What's going on, everybody? Joe here again. Welcome to the channel if you haven't seen any of the videos before. I'm a nursing student right now, and I like to talk about some of the things that people bring up in nursing school, some of the questions people have before they get into nursing school, and then some of the questions you'll have as you get out of nursing school and kind of move into the workforce. So today I want to talk to you guys about the 9 highest paying jobs in nursing. You may ask, well, why are you going with 9, man? That seems like such an odd number to go with. Well, it is. I see a lot of videos out there about like the 10 highest careers in nursing and all these other things, and they are phenomenal videos. What I'm going to do is a little bit different. I like to focus on progression, on progress, right? On making sure we correlate the tasks, the short steps we need to take in order to accomplish our overall goal. So what I want to do is give you 3 of the highest paying jobs depending on what degree you hold. So for instance, I'm going to separate it into associate's degree in nursing, RN, bachelor's degree in nursing, RN, and then advanced practice nursing, which would be things like a master's or a doctorate level nurse practitioner, or for instance, a nurse anesthetist and things like that. So I want to separate it in those categories because sometimes when you get into nursing school or you start nursing school, you don't actually know how far you're going to end up going. You know, either you think, oh, I'm just gonna get the basic out of the way. I'm gonna go be a nurse. I'm gonna start making some money. And that's really all I have a passion for. And then you get into nursing and you realize there may be a lot of other things you're really interested in. And some of those things might be advanced practice things, or maybe they're management on a unit. And that's, you have to hold a certain degree for that. So there's lots of other things that go into it. Maybe it's the other way around for you. Maybe you think initially, yeah, man, I'm going all the way through to CRNA and I want to be a nurse anesthetist. I want to put people to sleep, wake people back up safely. And then you get into it and you start shadowing, CRNAs, and maybe you just realize, man, this is not for me. I need to go a different route. This is really not what I want to do. So I really believe heavily in making sure you set mini goals or steps or checkpoints in your overall goal, right? If you're sitting back or you're just coming out of high school, or maybe you are, you've been a CNA for years and you're going back to nursing school, or whatever the case may be, if you look ahead and you realize you've got 10 years of school ahead of you, it may seem like a daunting task. It may not be something you even consider because the magnitude of the time commitment and investment you have to make for some of those things. But it might also just be because you are looking at it from point A, looking all the way down in point J or point W to see kind of what it looks like at the end, and it seems like a long way off. So sometimes when you separate your goals and you break them down into smaller portions, it makes them more tangible. So I'm going to break it down like that for you, okay? I'm going to go into 3 categories: associate's degree in nursing, bachelor's degree in nursing, and an advanced practice nurse. And then we're going to break down the highest paid positions in those 3 categories, okay? I'm not going to get into LVN or LPN right now, although that is a category in itself and it has its own. I'm just going to talk about registered nurses and beyond for now, okay? So let's jump right into it. Okay, let's start with associate's degree in nursing. So in an associate's degree in nursing, you generally have 1 to 2 years of prerequisites and a 2-year program for your registered nurse license and your associate's degree in nursing degree. The license and the scope of practice as far as care is concerned is going to be the same with a bachelor's degree and an associate's degree, but your opportunity down the road with a bachelor's is going to be a little bit different, okay? I am going to make some videos on specifically what these nursing practices look like. Feel free to go back to my channel and check and see if the video for the specific career you're looking for is already there. If it's not, make sure you subscribe, hit that bell notification, make sure that you get notified for the videos that I post. I will be posting over the next few weeks more in-depth videos on each one of these. So I'm just going to touch on them for right now and move on, okay? So the third of the top 3 paying jobs and careers in nursing for an associate degree nursing level degree is an at-home health nurse. That's going to just include essentially taking care. Usually you have 1 patient at a time. And you are moving from location to location taking care of these patients. The average salary for an at-home nurse is about $65,000 a year, and that is nationally, so you may live in an area where it's much higher. You may live in an area where it's a little lower. but nationally it's about $65,000. This type of nurse actually accounts for about 13 to 14% of the registered nurse population in the United States right now. All right, guys, number 2, the second highest paying job for associate's degree in nursing registered nurses is an outpatient care nurse. These nurses are going to work in outpatient clinics, and it can be anywhere from a cancer clinic where people are coming and getting treatment to an outpatient surgery clinic, to just a regular old outpatient clinic for your regular PCP that you see, okay? The average salary right now in the United States for an outpatient nurse is about $71,000 to $72,000 a year, which is a really, really solid pay, okay? So number 1, your highest paid ADN career is actually going to be a hospital nurse. Med-surg, surgery, ER. If you specialize, again, you're going to make a little more money. But for an associate's degree in nursing, that's going to be your best bang for your buck as far as the amount of money you can make. The opportunity there for hours if you want to pick up more, the opportunity for never really missing a shift because there's so many places you can be within the hospital. It opens up the door to be the highest paying nursing career for associate's degree in nursing RNs. And it's going to be about $70,000. When you say, well, Joe, you just said the other one was $71,000, $72,000. I did. That's accurate. But the opportunity that you have in the hospital is going to be much higher than an outpatient clinic. For example, an outpatient clinic, if the weather is inclement, you may close. If the doctor goes on vacation, you may close. There may be other options and reasons why you wouldn't have an opportunity to make money at a certain time for somebody who's working in the outpatient field. But for nurses, registered nurses in a hospital setting, the opportunity is always there. That's why I put that at number 1. So you have the ability, even when something does happen or your census is low on your unit, 99 times out of 100, you'll have the option to float to another unit, move to the cancer unit or the OB unit or cardiac or whatever the case may be, depending on the hospital you're at. So the opportunity there is going to allow you to increase that pay and that worth for that job. And those are your associate's degree in nursing. So we're going to move right on to bachelor's degree in nursing. So a bachelor's degree in nursing or bachelor's of science in nursing is going to include about 2 years of prerequisites and then a 3 to 4 year program for your bachelor's degree in nursing. There are some accelerated programs that only take 3 years, but the majority of them out there actually take 4 full years in the nursing program in order to receive your bachelor's degree of science in nursing. So with the BSN, it does open a few doors for you that you don't have as an ADN. So a lot of times with the BSN, it opens up some hospitals. So there are a few hospitals out there. Most of them are called magnet hospitals, and they require a bachelor's degree in nursing. Other than a few extenuating circumstances, they require a bachelor's degree in nursing in order to have a job there. Another thing that having a bachelor's degree in nursing does is it opens the opportunity for you to do some sort of management, some sort of teaching as far as like in-hospital training and having a team and a lot of things like that. Not necessarily charge nursing so much, but more like supervisor roles in that sense. A lot of times hospitals will require you to have a bachelor's degree at a minimum for those positions. So with a bachelor's degree in nursing, I want to talk about the 3 highest paying careers, starting at the least in terms of monetary value, but it is not the least in terms of value overall, and that is an ICU nurse. So an intensive care nurse or intensive care unit nurse, depending on where you live, may be called a CCU. They're going to come in at an average of about $62,000 a year. They're going to mainly take care of 1 to 2 patients, depending on what type of ICU you're in. You'll usually have a ratio of 1 to 2 patients, but your level of acuity for those patients is going to be much higher. Okay, so that's where the extra pay comes in. More often than not, almost in every case, you're going to need extra certifications because you're going to be looking at advanced airways and intubations and treatment of patients in a lot more acute situations. So that's going to run at about $62,000 a year for them. Okay, so number 2 on the scale is a pediatric nurse. Okay. A lot of people, when they get into nursing school, they want to stay away from peds, and that's just one of those things. They're small and they have a lot. Their margin for error is a lot smaller when it comes to medications and treatments and all those different things. So pediatrics is a very highly skilled field of nursing to get into, and they're going to come in at a national average of about $65,000 to $66,000 a year. Again, Some hospitals are going to be able to pay you more. Some areas of the United States are going to be able to pay you more. So that does range pretty widely depending on what part of the United States you live in. But because of the need for pediatric nurses and it being such a specialized field, the pay is often very, very good. All right, number one in terms of a bachelor's degree of science in nursing, registered nurse in terms of salary is a surgical nurse. Yes, a surgical nurse. Surgery nursing for a lot of people is like the creme de la creme. It's the one they want to be in. A lot of times your shift is going to be from about 5:30 in the morning to about 3 o'clock in the afternoon, give or take, depending on the situations. And it's, for early birds especially, it is a great opportunity. A lot of times you can be off in time to take your kids to school and pick them up from school and do a lot of different things like that and incorporate a lot of family time. And they're very well paid because, again, you really have to be on your toes. You have to know what you're doing in a surgery situation. If you have a patient that's coming out of surgery and out of anesthesia, you have to know what to look for, how to respond, all those different things. And the margin for error is, again, very, very small when you're talking about people who've just been sedated. The national average for salary for surgical nurses is actually just shy of $75,000 a year. Again, this is nationally. I would absolutely recommend you looking up those values for you specifically where you're at. For example, we know California pays astronomical amounts to their nurses. And when you go into a place where the cost of living is significantly less, like a place like Texas or Louisiana, you're going to see a lot lower pay, but you always want to incorporate the cost of living into your overall value, right? So if you're comparing California to Texas and you're comparing, $60,000 in Texas versus $120,000 in California, you also have to understand that the cost of living in Texas is substantially less than the cost of living in California. So if you're comparing different states, just make sure that you're comparing them apples to apples and considering cost of living into your numbers. All right, so moving on to advanced practice nursing. Now, advanced practice nursing can mean a couple different things, so I want to talk about that for a second first. An advanced practice nurse, or a nurse with a terminal degree, a lot of times it's referenced, is a nurse that has gone past the bachelor's degree to at least a minimum and oftentimes a doctorate level nursing degree. Now, you can go a couple different routes when you get to the master's and doctorate level in nursing. You can go the nurse practitioner route. You can go the certified registered nurse anesthetist route, and you can also go the nurse midwife route. Now, there are a couple other things like a nurse manager and things like that. Nurse educators, a lot of those have master's degree level degrees, but I want to talk about specifically clinical settings if you are wanting to be a practicing nurse. All right, so the number 3 spot is a psychiatric nurse practitioner. Psychiatric nurse practitioner is either going to work in a hospital setting or specifically a psychiatric facility setting, and they're going to do nurse practitioner duties, which include writing prescriptions, seeing patients, general and autonomous practice in terms of treating your patients the way that you see fit, diagnosing and treating diseases and illnesses, and making sure people are staying up on their medications, okay? And that psychiatric mental health nurse practitioner salary is going to come in just shy of $110,000 a year. A person could live off $110,000 a year. So great income. They compensate very well. The responsibility is obviously highly increased. You are now writing your own orders. You have people working with you. You're working with a care team. But essentially, for the most part, depending on what state you live in, the responsibility of that patient in terms of the entire care plan and the prescribed medications and treatments, that's all on you 100%. So the compensation is obviously reflective of the responsibility increase as well. The second highest paid is also a nurse practitioner. And this one is a neonatal nurse practitioner. Again, you can see the compensation to risk ratio and correlation is highly connected. The higher the risk, the higher the responsibility, the higher the acuity. All of those things influence the amount of pay that you get in the nursing field. You are going to see an average salary of about $112,000 to $113,000 a year. Very, very well compensated for that. And again, if you're more curious about specifically what those different positions and those different things will do, or what those jobs entail, please hit that subscribe button. Let me know in the comments which one you're looking for. Maybe I can prioritize that video, and I'll give you a little bit more information about that. Okay. The number one, and I'm sure a lot of you are not surprised by this, the number one paid advanced nurse or advanced practice nurse is a certified registered nurse anesthetist. Now, a certified registered nurse anesthetist, or a CRNA, essentially on a very, very basic level, has a very similar scope of practice as an anesthesiologist, so a physician anesthesiologist. One went to med school and did a residency, and the other went to specifically CRNA school and has a doctorate in nursing practice for CRNA. They put people to sleep, they wake people back up, they're there with you during surgery, before surgery, they usually follow up after surgery, and they are essentially the ones 100%, depending on where you live, 100% responsible for not only putting you to sleep, but waking you up safely and adequately. The average salary for a CRNA in the United States is right around $140,000 to $150,000 a year. Again, depending on where you are and which specialty in CRNA you choose, that can vary drastically. There are parts of the United States where CRNAs can expect to make over $200,000 a year, and there are parts in the United States where CRNAs can expect to make about $130,000 a year. There's a very wide range of pay depending on where you live and depending on what specifically you do is in the CRNA role. If you specialize in cardiology, or you specialize in neonatal, or you live in a rural area and you practice in a rural area, all of those things influence the pay that you receive. So jumping back through it really quickly, as an ADN, going from least to greatest, you have your home health nurses making about $65,000, $66,000 a year. You have your outpatient care nurses, which are making about $71,000 a year. And then, of course, you have your hospital nurses, which are making about $69,000 to $70,000 a year, with lots of opportunity for overtime and lots of availability of hours, so they're a little bit more consistent. As a BSN, your top three going from least to greatest are ICU Nurse, which is going to make about $62,000 a year, Pediatric Nurse, which is going to make about $65,000 a year, and a Surgical Nurse, which is going to expect to make about $75,000 a year average. And then as an advanced practice nurse, the three that you can expect to be the highest paid are a Psychiatric Nurse Practitioner, a Neonatal Nurse Practitioner, and a certified registered nurse anesthetist. All three over $100,000. Psychiatric nurse practitioner coming in at about $109,000. The neonatal nurse practitioner coming in at about $113,000, and of course the certified registered nurse anesthetist ranging from $130,000 to $200,000 average in the United States. If you have any questions at all, leave a comment down at the bottom. If I've added value for you, smash that like button. If you're curious about those positions and you would like to hear some more about them, please feel free to subscribe, hit that bell icon so you're notified when I post new videos, and I will be getting on those over the next few weeks.